Welcome to iCCaRE TV. I'm Dr. Folakemi Odedina, and this is one of the conversations that we have with our prostate cancer survivors, just to give you an idea about how we have survivorship care, as well as what some of our survivors go through in their journey of prostate cancer care and survivorship. Today we have with us one of my brothers. He is actually a scientist, so you can see that prostate cancer has no color, has no pedigree, does not discriminate. It can happen to anyone. We have with us today Dr. Zubair. Welcome.
Thank you. Thank you.
So, these conversations about prostate cancer is something that I have been having with a lot of Black men all over the world for over 30 years. And it's very interesting to see how the journey of prostate cancer survivors differs from a lot of people. So I want us to kind of go a little bit way back before you were diagnosed with prostate cancer. What did you know about prostate cancer? I mean, I know you are in the health field, so you most probably know some things, but just kind of talk to us about what you knew about prostate cancer.
Absolutely. So again, I'm a physician, so that I need to know about cancer in general and specifically prostate. I also have a PhD in cancer immunology. So clearly I have a good understanding of what cancer is, and particularly prostate cancer, which is, as you know, the most common cancer in men all over the world. A major problem also in Africa, being one of the most deadly, while in other populations it's not as deadly. It so happened as I lost my dad when I was 5. So obviously, at 5 I don't know anything, but as I grow, my uncle brought me up. He was a veterinarian himself, so he knows a little bit about medicine and biology, but mainly for veterinary animals. So he has a good understanding. So I asked him when maybe I was 8, or we discussing what happened to my dad, because I barely know him. He said, yeah, he pee out blood. He think he has chronic schistosomiasis. This is a parasitic infection that during maybe the 40s and 50s, when my dad was growing up, is prevalent if you swim in contaminated water. So he thought maybe he had bladder cancer, because chronic schistosomiasis may result into bladder cancer, and that would kill him. So it kind of sank in my head. But as I learned, going through medical school and also knowing more about cancer during my graduate years, I begin to suspect, could it be prostate? Because it doesn't seem, I mean, if you just by chance, he's more likely to have prostate than bladder. But obviously, as you know, in Africa, chronic infections are prevalent, and some can lead to cancer. So I had that at the back of my mind.
So do you know how old he was when he died?
In Africa, it's not always the case. I know he is either in his 40s. I'm the last born. And my sister is way older than me, because her second child is older than me. So, but I know he died in his either mid-40s to early 50s. I don't know his age specifically, but it definitely is premature.
And that's one of the things that we see, because so when we look at the risk factors for prostate cancer, it's the family history, it's the fact that if one is Black, you have the history, and then the age. But the curious thing about happening in that Black population within and outside United States is this idea that at the lower age we seem to be seeing prostate cancer at the lower age.
Yeah, absolutely, and definitely more aggressive as well, relatively to other populations. So, I mean, bearing that in mind, I was very conscious of what will become of me as I get older, and knowing also more about cancer. So I made the point that on my 40th birthday, that I need to have my PSA check. This is the most common screening tool. I know it's controversial in terms of the cutoff, but I want to make this point very important. It might be controversial for Caucasian, for others. I really think PSA is still one of the best marker for detecting and screening prostate cancer in Black population. Why? Because even though there are other conditions that can increase your PSA, but now we know the PSA density, which is the ratio of PSA and the volume of the prostate, or what they call PSA velocity, which is the rate of rise of PSA, is a quite sensitive and predictive marker for prostate cancer. And knowing that prostate cancer is more aggressive in Black, this is not something I will play with it. And people say, oh, cancer, we don't have cure for cancer. We do. The cure for cancer is to detect it before it becomes a problem.
Absolutely.
You just yank it out and you're good. Just like when you do colonoscopy, you see a little polyp, which is a tumor. It hasn't become cancer. You take it out, then you're cured. So in my mind, I'm one of those people. Of course, I know everybody has his own style of it. I like to know about problem. I'm not the kind that people don't want to know. I want to know if there's a problem, because then I can prepare for it and
we
see
a lot of that.
Yeah.
We see a lot of that in our community. I wanted to ask you a question, though, because I think this is really very important. But before I ask you the question, I wanted to just kind of quickly state to our audience that the latest American Cancer Society statistics about prostate cancer actually is seeing an increase in the incidence of prostate cancer, and also at a late stage as well. And one of the things that has been linked to this is exactly what you're talking about. This idea that people are waiting before they are screened, the PSA controversy. Now it's coming back to haunt us. Now we're seeing people really diagnosed at a late stage because of this controversy. But I wanted to ask you, knowing at the back of your mind, you felt, okay, my dad most probably died from this disease. I need to start at 40 to start screening. Did you think about doing anything preventative at all? But a prevention, sometimes.
Not really. And truly, I know. I mean, again, being also a cancer scientist, I know how cancer cells are. It's not everything that. I mean, even some of the preventive, there are few cancers that you can truly prevent. And even that you can say not 100%. So again, the best prevention is detection early, before it becomes a problem. Remember, every cancer technically evolves out of one cell. So if you can find that one cell, it might be like a pinch, you're done with it. So people say, oh, as you know, prostate cancer patient may not have any symptoms. There is really nothing. And the key is you want the cancer to be detected before it causes any problem. Because if it does, already it's too late.
Yes, when you start seeing the signs, I'm so glad that you mentioned that, because that's what people don't know. It's like, I'm waiting to see the signs and the symptoms. When you start seeing the signs and the symptoms, that's at the late stage. Informed early detection is really very critical. So kind of take us now to your journey of the diagnosis. So you at the age of 40, going back to the story, you said, I'm going to start.
So I talked to my primary care doctor. He said, no, it's 50, and for Blacks can be started at 45. I said, well, for me, it can be 40. and he's a colleague. He knows I'm a doctor too. So he said, okay, it's just a blood test. And we did the test, and it's normal. So I feel relieved. I said, oh, it's normal. It was like maybe 2.5, 2.7.
Still on
normal. Then by next year, when I had my
Annual,
41st, so around my birthday, I have my annual check. It has gone up by almost 1. So it was like 2 point, now it's 3.5. So anything increase more than 0.75 is a sign, alarm. All right. So again, just, it's 3.5. The cutoff generally is considered like 4, you know, but so I could just say I'm fine, but clearly there's a huge jump. So
and there's something that is responsible for that huge jump in PSA.
So he said, you know, likely, did you run, if you ride a bike or did something, your PSA can go up. I'd say, well, let's check it out. So he sent me to a urologist. And they said, well, that's quite a jump. Let's just do ultrasound, you know. And, you know, it's not anything, ultrasound is not invasive. Even though the one I had is transrectal, so it's not the most pleasant thing. I don't want to go into, but it's but it is, you know, it's all fine. Then once the ultrasound, there's areas of this that doesn't look right. Say, okay, it's just a small segment of the prostate. So, well, we need to look further. We need to do a biopsy with this sharp increase and this ultrasound, you know. So, and then a biopsy was done. And then the pathologist, my friend, we're in the same department. He called me. He said, it is there. The good thing is in like this quadrant. I mean, by then my head is all over like. And
I want to really talk about that. But first, before talking about that, I think it's very important for us to really emphasize what happened. What age were you?
I was I started 41. 41.
I just want us to pause. I kind of listen to that because a lot of times those recommendations are like 50. Okay, maybe if you are at risk for men at 45. This was at 41.
Yeah.
And I think you were able to get the result that you got because you're also a physician.
Yeah.
And this is one of the reasons why it's so important to have advocates who can advocate for us. Because there are a lot of people who are not physicians, who are not in the healthcare system, who do not understand the healthcare system. Yeah. And I think if my doctor said I should not worry at the age of 40, my doctor knows what she is talking about, right?
Yeah.
So it is really a point why it is so important that we need to look at this based on the risk that the individual has.
Yeah. Yes.
Like, you know, being Black, having a family history is kind of definitely. So let's go back to that point. When you had, yes, it is cancer. And you are a physician, you know.
I'm telling you, is and because as a physician, a scientist as well, you know too much.
Yeah, I know.
And you tend to overthink because you know, and my colleague, the pathologist, you know, we would do some more genetic testing to look for, you know, P53 mutations. You know, that shows it's more aggressive. I was like, now all the stuff that it looks alien, you know, you never think of it. Now it's happening. You know, so wow. that was, and then potentially it can be, it is aggressive. So then I had MRI, and the idea of the MRI is to stage it to see what extent has it spread to neighboring lymph nodes. So it was done. The good news is it was codified within the process because it was really early.
But we have to, you know, it's all also due to you advocating for yourself.
Exactly.
Insisting that you take that test at 40. Insisting that when there was a rise, let's take a look at it, right?
Yeah, no, I would really advocate for that you need to be your advocate and assess the risk. Yeah, a little inconvenience, but the consequence of ignoring the problem and having it spread, and that even if, I know we'll come to what kind of therapy I got and stuff like that, but it is important to weigh the risk and the benefit. So don't, it's a blood test, so what's the big deal? versus you may die because you just ignore the problem and it brew. So that's my attitude about, diagnosis. I want to know. It doesn't mean that's the end of the world. I will fight it. I would, I would see my options. Hey, I'm a person of faith. We all gonna die. Everybody will die. So it's not but nobody wants to suffer.
Yeah.
Or you don't want to die prematurely. So you need to really be your own advocate and know yourself and be proactive. Again, don't say I'm fine. What you don't know is the worst part of anything. So when all is quiet, but there's a problem that you're not aware, that's the danger. It's not when something is hurting, you know the problem. So then, and you don't want to wait till when it's too late. So
that is so important to know, and I'm so glad we're having this conversation with you, because I think it's very important that people really see different faces of people that are prostate cancer survivors, and it's not, to really know. You are a physician scientist, one of the top most physicians, very highly accomplished, and the prostate cancer did not say, "Oh, you know it all, so I'm not coming to that side." But you are also able to really advocate for yourself very well, so that you are able to get what is needed. For a lot of people in our community, because this is my area of research, people are so scared of hearing it. But why this show is so important, that people see that you can survive it, as you said, early detection. So as we wrap up, tell us a little bit more about what treatment did you choose, but with the acknowledgement that this was like you detected this early. Right?
Yes,
so
So the key thing was the younger you are, and also the earlier the detection, the better to go for surgery.
Yeah.
Because then you just take it out. So I had surgery, I never had chemo, and I had the robotic surgery. So, it's not like I got my whole tummy or open. It's a pinholes, and David Thielen, a very outstanding urologist, did my procedure. A good friend of mine as well. We still, I see him, I say, "You are my angel, guardian angel." And I was lucky, so it was all removed. It's over 10 years now since I had the surgery. And, every year I have my PSA check when it's 0. So you get apprehension. But, after the 5th year, the 6th year is fine, so then you
I think I can relax.
I can relax. So
I'm so glad that you're talking about, after the successful surgery and the treatment, that there is a need for survivorship care afterwards.
Absolutely.
And what are some of the things that you are doing? You talk about the fact that you still do your PSA regularly, annually.
Yes.
Are there any other survivorship care tips?
I mean, the good thing is it's nothing different from what you would do, even if you don't have prostate. So every year you should have an annual check. This is pretty standard. Prostate should be one of the things that needs to be checked, and that's the PSA. It's a blood test, just like other blood tests. It doesn't really. So that's the key, and then again, if you have issues or one of the side effects of the surgery is incontinence or impotence. So those are the things that need to be checked. But generally, I was lucky, none of that. I didn't have incontinence. I didn't have, impotence. So it's very important. And again, all of that is to do with early intervention. The other thing to do after, as a survivor, is maintain a healthy lifestyle, exercise, eat well. I run or walk, and that also help in your body healing and recovering and not having any side effects.
Thank you so much. I mean, I know that, not a lot of people would share their prostate cancer survivorship journey, but
Yeah.
it's really great that you are willing to be open and talk about this,
Yeah.
because it's very important that people see that there's life after prostate cancer.
Yeah.
You can survive
Absolutely.
prostate cancer, and you
Absolutely.
can live healthy right
Yeah.
after prostate cancer. So I'm going to put you on the spot as we wrap up. We think about Black men globally. This is who we are targeting. What are some of the top 3 things that you would advise, that you have learned from your journey, that you would say, as Black men, it is really good that you should do this? Just top 3 things.
Yeah. Well, the first thing is to know you are at high risk of developing prostate cancer. So whether even if you don't have family history, so knowing that you are at higher risk, and if you have it is very aggressive, it means you need to be more vigilant. So, number one thing is really having your annual checks. I think is universally agreed now for Black people 45, and if you want to be a little bit more aggressive like me, 40 would be...
I made sure my husband started at 40. I just want to say that.
Yeah, so...
It doesn't have a family history, but I said still, you have to get your baseline, and we have to see whether the PSA is rising or not. So at 40, we do it.
So I think, and again, it doesn't cost anything. Healthy lifestyle, whatever. This is not specific to prostate. If you have a healthy lifestyle, you are more likely, it's like a fight, it's a war. Everything will come easy. Your body can heal better. You can really, everything really, when you exercise, you eat well, you are stress-free, you are well-balanced, you sleep is very important.
Absolutely.
So I think to me, those are the key things that I would say every Black man needs to be aware of, and ignore the controversy or this is, yes, PSA can go up by other things, even cycling, or infection, or just benign enlargement of the prostate. But so what? If your PSA is high, what it tells you is just you need to be more vigilant and follow through, and being consistent. So the first time my PSA is normal, if I was negligent the following year, I didn't check it, then it's all wasted. So being consistent is very important.
Thank you so much. I mean, it's such a great pleasure talking to you.
Thank you.
And now you understand one of the reasons why it's so important to kind of hear from our survivors about how their prostate cancer care and survivorship journey is. It's been so great hearing from Dr. Zubair. He has shared his journey, and he's healthy, and there is really a great way to overcome the disease and be able to still live a healthy life. Thanks for joining us. Till next time, I'm Dr. Folakemi Odedina. Thank you.